I'm Robert Lefevre, I'm the director of the Promis Recovery Centre. What we're hoping to do with these short clips is to help people to understand the nature of addiction and what can be done about it. Anxiety. Anxiety is a normal feeling. Fear is a normal feeling. I'll give you two examples. Supposing a young child is about to put his or her hand on the hot plate. What we'd say immediately is, no, hot, hot, hot. We would try to make the child anxious, make the child fearful, in order to protect the child from putting the hand on the hot plate and getting terrible burns. So normal anxiety, normal fear is protective. I remember a time when I'd had lunch at Bertarelli's restaurant in Charlotte Street, and I came out afterwards feeling happy, and I went, woof! A taxi missed me by a split second. I'd forgotten Charlotte Street is one way. I'd looked the wrong way, and the taxi just missed me. A split second difference, and I'd have been an ex-Robert. Well, you watch me cross the road now. I mean, the Green Cross Code's got nothing on me. It takes me about half an hour to cross the road. You know, I just do not want to be flattened. Because having had that experience, it reminds me always of just how precious life is and how easily I could throw it away if I don't have the natural caution, which is based upon my anxiety, fear of being flattened. Now, what happens beyond that is that, as M. Scott Peck says in The Road Less Travelled, life is hard, life is difficult. We do have a lot of things on our plate. You know, we're worried about what the government legislation is. We're wondering if we're ever going to be able to square the demands of health and safety and normal behaviour. We wonder what on earth our children are ever going to turn up like. We wonder whether we know enough. We wonder whether we're getting old. We wonder whether, you know, you name it, we're anxious. We've got issues on our mind. And with addicts, what we then do is to make it much worse by using alcohol, by using drugs, by using sugar, by using nicotine, by using gambling. We make it worse. We think we're making it better. Because initially we do feel better. But the effect of any drug initially is to provide the beneficial effect and then the withdrawal. If you look just at nicotine addiction causes exactly that. You feel better with the cigarette and then crash. And what do you say here? You say, I need a cigarette. You need a cigarette like a hole in the head. Look what the cigarette caused you. This problem you got here was because you took the cigarette there. This anxiety was caused by that cigarette. And what we say is, I need a cigarette. So we take another one and look what happens. Exactly the same as before. And here we say, I need a cigarette. We perpetuate our problem by using a short-term solution. I haven't smoked in 30 years. When I was the cardiology house physician on the wards at the Middlesex Hospital, I was looking after people who were dying of heart attacks, and on the lung ward underneath, they were dying of lung cancer and chronic bronchitis and emphysema. And I was smoking 30 cigarettes a day. And why was I doing that? In order to change the anxiety that I had. Well, I think it's perfectly healthy for doctors to be frightened. I think it's perfectly healthy for doctors to think we don't have enough information on how to help our patients. But I don't think it was helpful for my patients to have their doctor smoking 30 cigarettes a day. I just don't think that was very sensible, either for them or for me. It was a bad choice. So how do we treat anxiety? Well, diazepam, you know, or any of the other PAMs, the benzodiazepines. Well, I had a battle with, well, two battles. The first of all was with a consultant psychiatrist. A number of us had been invited to go over to the States to see a particular treatment centre. You know, they paid for our travel, they paid for our trip, and they hoped that we would send them patients. And the consultant psychiatrist on the plane, there were about 20 of us, came up and down the aisle handing out sleeping tablets and tranquilizers. He thought he was being generous to us. giving a mood-altering drug. It cannot be right. Subsequently, I had a battle with the makers of, again, it was one of the other PAMs, I forget which it was, Temazepam I think it was, which they were making as an ampule. And they said, we're not going to prescribe it as an ampule anymore, we're only going to give it as a tablet, because the ampules are addictive. And I said, look, it is not the ampule that is addictive, it's the drug. It's the drug itself. All the benzodiazepines are addictive. I had a major battle with the pharmaceutical industry at that time. This was about 15 years ago. And I had a lot of hostility from other doctors saying, but you've got to give people tablets when they're anxious. You've got to help them. And you're not helping them. I said, oh yes, I am. But you are not. You're giving them a short-term drug. You're not actually dealing with the anxiety at all. And I have exactly the same attitude towards antidepressants. Anyway, subsequently the battle was won. People did realise that benzodiazepines are addictive. And nowadays they're much less prescribed than they were before. So, what have doctors done? What have the pharmaceutical industry done? Gone straight across into the antidepressants, saying they also have a tranquilizing effect. So now we treat the fear, the anxiety, with antidepressants, with a selective serotonin reuptake inhibitors, Prozac and its friends. Again, it doesn't work. Doctors don't seem to be able to get it into their minds, because of the way we're trained, that we shouldn't use tablets for emotional problems. We shouldn't use drugs for emotional problems. Anxiety is a perfectly normal feeling, and there are non-medicinal ways of treating it. Again, the 12-step program is the basis of learning to let go of all the various problems that we may have, keep a clear mind, work with others, ask people for their advice, for their help, for their support, for their understanding, work with other people, and your anxiety will be manageable. The number of things I've got on my mind at the moment is far more than, and far more significant than problems, than anxieties I've had in earlier years. I've had plenty. But I've got a huge amount on my head at the moment. But I can cope with it because I've got the experience of working the 12-step program. I've got wonderful professional advisors, got wonderful family, wonderful staff and friends. I've got so much support, I don't know what to do with it. And therefore, all the anxiety becomes manageable. Previously, when I tried to do it all on my own, it was completely unmanageable. So the way through to treat anxiety is with other people. Do it on our own and we fail. Do it with other people. And any problem can be solved.